is a service and a platform to create and deploy fully native, custom cross-platform patient engagement mobile apps in a matter of minutes. The immediate need for patient engagement is one of post-discharge. Readmissions occur as patients and caregivers don't really understand discharge instructions. They don't follow regimen. And there's poor communication about the patient's progress or lack of back to the physician. On the longer term, insurance companies are looking for technology aids that will help combat onset of diseases. By 2020, 157 million Americans will be diagnosed with chronic conditions. 81 million of them with multiple conditions. The market for patient engagement in the US is over $15 billion. They include preventive care, emergency care, and chronic care management. Now, there are a number of different products out there that are trying to meet this need, but they have some very significant gaps. Firstly, they're boilerplate apps. They need heavy customization. UI, content, and logic-based customizations are needed, and this requires a lot of effort and money. Now, this is a very significant problem, as there's considerable variation amongst physicians for regimen standardization. Now, each one of these custom apps needs to be rolled out to both the Android platform and the iPhone platform. That's a significant overhead. Lastly, there isn't good support for comorbidity. So Sedara Care addresses all of these gaps very, very efficiently. We create custom apps that are customized to the practice and to the condition. Now, with a patent-pending technology, we can create apps in a matter of minutes. Now, these apps will be exactly written to the specification of the practice. Now, these apps actually mimic an in-office visit, a conversation between a physician and a patient. Now, what this lets us do is actually offer customization as a service. Now, the resulting app can be deployed in a fully native manner to both the Android platform and the iPhone platform. What this means is that all of these apps will have complete access to all the device functionality and peripheral integration, like blood pressure, blood sugar, and anything else. Predictive analytics that proactively spots trends with summary and detailed reports, and full comorbidity support, where multiple apps can be deployed onto the same patient device and run seamlessly as a single app. Now, here are the use cases that we're looking at for Sedara Care, and each one of them will be an app developed on top of the platform. With me is Girish Narayan, who's a domain expert, who's a very respected cardiologist in the Bay Area. And I personally have more than 25 years of software development experience in startups and large companies like IBM, AT&T Bell Labs, and Oracle. Param, our architect, is ex-Zora, IBM, and we have a very illustrious advisory board which brings to the table many, many years of deep healthcare experience. We just got our version 1 release of the product out, and we are provisionally HIPAA compliant. We're looking for about $2 to $3 million in seed funding to execute on our pilot projects as well as enhance the product. We are looking to sell to systems of care, accountable care organizations, hospitals, surgery centers, and insurance companies. Introductions to these are welcome. And these institutions are going to use Sedara Care to actually provide coordinated quality care for their patients and manage the total cost of care. Thank you.